Disclaimer. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. And now...
Yeah, we don't want to do anything to scare your children. That's the last thing we want to do. We don't want to scare anybody.
Ladies and gentlemen, please welcome Ben and Amy on The Heavy Truth.
Hello, I'm Amy.
Hi, and I'm Ben.
Welcome to another episode of The Heavy Truth.
Yes, welcome in. Welcome back. Hello. How are you? You.
I
talking to you.
I thought you were addressing our listeners.
How are you, listeners?
All is good.
Dead silence, just like talking to you, Amy. How are you?
I'm good. I'm well.
Clearly well. Mm-hmm.
Clearly well.
Mm-hmm.
Yeah, no, just living the dream, Ben.
Oh, yes.
Living the dream.
Dream.
Yeah. I don't have anything new to report this time.
No? Nothing?
No. I don't, just maybe getting ready for the holidays, but that's always a task in itself. But
Did you decorate and everything for Halloween?
Halloween
since
was
that's
decorated
passed,
for.
yes.
Yep. I don't want to say waste, because I know I like Halloween a lot, but I don't want to put out like a lot of Halloween decorations out front, because then you got to take them down right away. And so I just kind of do it for fall-ish.
Oh. And what are fall-ish decorations?
Pumpkins and hay bales and corn stalks.
Oh, like a hootenanny.
Like a hootenanny,
Yeah.
I guess.
Okay.
But inside is decorated for Halloween.
Oh, gotcha. Where do you park your broom? Where you put your hat?
My broom is always available.
It's at the front door. Why don't you tell them
Her broom?
Yeah, her broom is.
Oh.
Yeah. Why don't you tell them about the corn stalks, Amy?
Corn stalks. Is there a story behind this?
Yeah, so
Did you make producer Mike just get out in the random field and pick corn stalks by the side of the road in the middle of the night so no one saw you?
Well, to be fair, they can be quite pricey.
Okay.
Okay, so first we had to find a place that wasn't like gonna break the bank or anything, which we did, and then we went to go get them in our car, and yeah, they were a little big for the car, so they did fit, but I could not see Mike driving. Mike could not see me driving, because they went from the entire back of the car all the way to the windshield.
Oh.
So
how many
three.
corn stalks did you get?
3.
For your fall decoration?
Yeah, 3. But my whole thing was, I'm not even thinking about the fact that he can't see where he's going. I'm thinking about that there's going to be a spider coming out of these corn stalks.
Girl, I would have opened that window and out the whole damn corn stalk would have gone.
Yeah. But they turned out
Was
nice.
there a spider in them?
No.
What was the bonus I got to do after that?
I don't think we can talk about that online, producer Mike.
Oh, okay. With the car.
Oh, he got to clean the car.
That's a bonus?
No, he's being sarcastic.
Oh, I thought maybe it was because of his OCD of cleaning. He was all excited he got to clean that, because you can twirl on right outside. Mine's parked in the driveway and clean that shit up.
It was full of corn husks and corn and spiders and...
So there were spiders in it? I didn't see spiders. Oh. So will this be an annual fall harvest decoration thing?
Yeah,
or can you
probably.
just save these for next year?
No, you can't save them.
Why?
We'll probably take Granny's car next time, because it's dirty anyway.
Oh, yeah. Makes sense. Makes more sense.
So true.
Yeah.
After you get rid of whatever she's got hiding in the trunk.
Yes. There's probably pumpkins rolling around back there. I haven't even noticed. I haven't been in it in a while.
Yeah.
That happens.
Yeah.
So,
Makes sense.
Yeah.
Yeah, we went, again, we do decorate inside and outside. We went to for Halloween. So I guess some of it will stay out because, like you said, pumpkins. So we went to the pumpkin patch.
Yeah, that was fun. It looked like a whole festival you had.
Yes, it was very fun.
Singing and some...
I wasn't singing. Yes, some people were strumming a banjo and blowing a harmonica, accordion. Yes, singing something. My mother, my granny sat drinking her coffee and eating an apple cider donut while we went into the pumpkin patch.
Yeah, looked great.
It was fun.
That's Wisconsin for you.
Yeah.
Yeah, we don't have a lot of that.
Six or seven pumpkins, and it only cost us $36. Big pumpkins too.
Okay. Yeah, that's not bad.
Yeah. And then all the Target Halloween birds inside the house. Not my choice. Those are my husband's tchotchkes.
They're cute.
Okay.
I mean, you have bats on your wall too. Is that
That's
him or
true.
you?
Those are cute. No, those were him, and those were bought on Shein.
They're cute.
He's like $5 for all of those or something like that, and they blink and they're cute. And those will stay up like for a bit. Yeah, as once we head into Christmas, then because I love Christmas, so then we'll decorate for Christmas. The tree stays up, all of that, right? Even though like every time I get home or I'm home, my mother's watching some Hallmark Christmas movie. I'm like, already? You can't watch them all because then all I hear about is I've already seen this. Girl, they're all the same premise. The Christmas tree farm there's something wrong with that. And, she's coming home from New York for a visit and has to stay there. There was an old boyfriend that shows up who has to be in town too. And then the blizzard and everything. And at the very end, everything's great. The Christmas tree farm is saved and Merry Christmas, the end. Then there's that almost kiss and then they fight and then a kiss and then it's over.
Or it's the single mom with like a child.
Oh, yeah.
Meets a dad.
Yeah.
Meets a single dad.
Meets another single dad whose wife died of cancer 3 years ago, exactly on that day. And yes. And then there's a girl who isn't really the girlfriend, but is really close to them who thinks she wants to be the girlfriend. And so the woman that with the child thinks that they're together because she happens to see them at the, store buying a gift, which is for her, but she doesn't realize that.
They're feel-good stories. I mean, they're fine. They're good.
Yeah.
Or you could watch Ed Gein.
Yeah, that's Christmassy.
Yeah, that's Halloween. More Halloween.
Yeah, that's Halloween. Yeah. Yeah. But
what
are we talking about now?
What are we talking about?
We're talking about lipedema, not lymphedema.
Right.
Lipedema. There's difference.
Lipedema.
Yeah. What's the difference, Amy? What is lipedema?
So lipedema is an abnormal collection of adipose tissue or fat. Whereas lymphedema is more in the lymph system. It's more swelling. So you definitely do not have. No, I think you can have both. I'll take
me.
That back. No. People in general, you can.
I was like, what are you trying to say?
No, not you. People in general.
This is done. Next topic. Okay.
No, people in general can have both. But I feel as though it is something along the lines of something that people don't understand what it is.
Yeah.
And if you've
and by
ever
people, you mean me?
No, not necessarily. No, just
maybe
patients,
okay.
Individuals.
Okay.
I don't know. I mean, if you're learning about this today too, that's great. But it's a lower body fat, like stubborn lower body fat, and oftentimes it's in your thighs and in your legs. They're heavy. They're very tender.
Yeah. It's almost exclusively though in women.
It is. Yeah, absolutely. And I don't think there's any rhyme or reason behind it. It probably has to do with genetics, yes, but also hormonally. Yeah.
The actual definition, for those of you wondering, is a chronic condition characterized by disproportionate symmetrical accumulation of adipose or fat tissue, usually in the lower body, right? Legs, hips, places like that. Occasionally the arms, and like we said, almost exclusively in women.
And you can have lymphedema in one part of your body. You can have it in your right arm, your left arm. This is, like you said, symmetrical. So you're going to have it both sides.
And again, we're talking about lipedema.
Lipedema.
Right.
It typically spares the feet and may look like you have like a rubber band around your ankle.
Those are those memes you see where people have their shoe in a small foot, a foot in a small shoe, and then their like ankle is all swollen around it.
Yes, that's exactly it. For sure.
Yeah, looking like they need some
diuretic.
Diuretic, yeah.
Heaviness, pain, tenderness, easy bruising is another sign of it. But there are different stages of lipedema. It's very interesting. I have researched it a little bit more. I do have a handful of patients who struggle with this, and there's not a lot of resources out on it, but we do kind of go over it a little bit. But there's stage 1, 2, and 3. Skin is still smooth around on the stage 1. The fat tissue is thicker, and you may feel some small nodules. That's like one of the key things.
Yeah, like little beads. Or
Little
when you
beads.
Feel,
Like those things that blow up in water when you put them in there.
Oh, no.
Yeah. Well, kind of, yeah.
What do you mean, things that blow up in the water?
Those are like, Orbeez. You know what those are? You put them in water and they soak up.
They expand?
Yeah.
Oh, yeah.
But obviously those are bigger. These are small little things, but feel like little nodules.
Okay.
The second stage, then the skin becomes a little bit more uneven.
Yeah, it's the surface of the skin, right? That's where, again, like you said, the nodules, right? That cottage cheese feeling, right?
Yeah.
Or like a walnut shell. You can feel something under the skin,
Yeah,
right?
you just don't really know what it is.
And then it comes to the final stage.
Final stage with large fat deposits, hanging folds, increased difficulty with their mobility, and then it may overlap with lymphatic involvement. That's why I said you kind of sometimes can have both of that.
Yeah.
So not only do you have lipedema, you have lymphedema on top of it.
Right. So then it's lipolymphedema.
Yeah,
Yeah.
definitely.
And it's not just from, right, people just think it is from being overweight, but that's a common misdiagnosis. It's not just from being overweight, right? So you could lose all the weight and still have this.
You can, yeah. I think it definitely will. It'll shrink down, but it's a different kind of fat.
Right.
So
because people will tell them, this will lose weight and this will, lessen that area, right? Make it smaller.
Yeah, and there's no exact cause. They don't really know what the cause of it is.
Yep.
And there's definitely not a lot of specialists that treat this condition.
Yeah. I will tell you, myself, my degree is in family practice, as yours is. But with the obesity certifications we have, it was until I started the really obesity certifications that I didn't have that clear distinction between lipedema and lymphedema.
Right.
Often I think people throw it all into one.
Yeah, no, absolutely they do. Yep, for sure. But if you've had your blood pressure taken or you've taken someone's blood pressure who completely freaks out because the cuff is too tight, oftentimes they have lipedema.
Right.
Because it hurts so bad. Because for one person, be like, why? That doesn't hurt. And then the next person, they're like screaming.
Right.
That's why, because it's painful.
Yeah. Yep. And like you said, there isn't there's nothing that points to an actual cause, right? But there are things that that they feel people can link this to people, right? Like hormonal changes, shifts like puberty, pregnancy, menopause. Many women will find that that's when they're affected by lipedema, right? Genetic pattern, often it can run in families. That old saying, look at the mother when you look at the daughter. That's a joke.
That is true.
Bad joke, but
it's very true.
Yeah. What else?
Microcirculation, connective tissue, lymphatic involvement.
Yep, like we talked about. Yeah.
Yeah. So the evidence is still really unclear, but maybe it has to do something with retained fluid, sodium, like trapping the endothelial permeability. So that's like part of your skin layers.
Right. And inflammation with obesity, right, can cause some of this. They're
because
very
obesity
distinct.
is an inflammatory disease process.
Right.
Anyway, yeah.
Yes. And a chronic disease. I have to say that again to people, chronic disease. Even though your BMI, may fall under 25 and you're then considered not obese, not overweight, anything, there's still that history of obesity because it's a chronic, kind of like fluctuating condition, right?
I get so irritated when I'm looking at charts and like they resolve any of those like old issues, no more history of obesity. They don't have anything wrong anymore. And I'm like, why are we getting rid of all this? It is a history of,
history of,
So frustrating. That's just my little
I
rant,
agree.
but
I agree. The funny thing is, I actually worked this weekend I pick up occasionally at in the urgent care setting, and I was speaking to a family practice nurse practitioner who was also picking up at the urgent care setting. We were chit-chatting about something, and he always asked me about weight management and bariatrics and GLP-1s, and he could reach me through the organization, things like that. But we were talking about that, and he was like, "I always come to ask you because you're a specialist in this and this and that." And I had said something about it irritates me when they resolve this. He goes, "So I resolve that," and I was like, and before I could say anything, say, "But wait, before you say anything." I resolve the obesity or the overweight, but then I put into the chart history of obesity, history of being overweight. But I always then also state like what their BMI was baseline when they started and where they are now and what they've been doing. I said, that's exactly what we want you to do. But I kind of put it to, like my grandma who thought because she was on metformin, she was no longer diabetic. Or then eventually when your blood pressure is under control and you don't have any more medication, that you don't have high blood pressure. You do. It's just diet controlled or a history of.
Were you going to say something, Mike?
Yeah, that's exactly what I was going to say about hypertension. Like it's the biggest thing that I go, once your high blood pressure goes away, why has it gone away? Because you're taking a water pill or you're taking something else?
Yeah.
Yeah, so it's not gone away. If you stop taking that, it'll come back.
Yeah, exactly. Your obesity hasn't gone away. Your being overweight hasn't gone away. You've taken the steps, whatever you're doing to get this done, whether it's surgery or whatever, right? But this, I think, can it be a little harder to deal with, I think, right? The lipedema, because we said it doesn't necessarily you can lose the weight and this can still stay there.
Maybe it just gets a little bit smaller, just like adipose tissue does. Like it shrinks up, right? But it's still I think they feel like it's a different kind of adipose tissue. It's a different kind of fat.
Right.
So the diagnosis, it's not really cut and dry, but it's definitely more off of just an exam and
Physical exam.
And patient complaints,
Right.
symptoms.
Yeah, because you're looking at the like we talked about those palpable nodules, right? The symmetrical fat, right? That the fact that it's sparing the feet, and I guess you then start to try to rule out some of the things, right? We're trying to rule out obesity or being overweight. You're trying to rule out lymphedema, which, like you said, usually involves the feet or one side. It can be pitting, meaning you press the finger into the skin and it leaves literally like a little indentation, right? And then, of course, we stage those +1, 2, 3, blah, 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 depending on how long it takes for the skin to, for that pressure point to resolve, Yeah, so, some of the red flags to ask, maybe your clinician that you're going to see is,
I feel you have to look, are both of your legs symmetrical? Is this something that is...
Well, I feel like that's a problem regardless of the lipedema. Both your legs symmetrical?
Yeah, right?
Sorry.
And, the question would be, does it, resist diet and exercise? Is it...
Your upper body may shrink, but the lower body stays the same.
And do you bruise easily or have any... Or is it painful or heavy? Because I do have people complain of that too. They'll...
Yeah.
Again, that's where I go back to like taking the blood pressure, I'll be honest, like I didn't in the past be like, wow, like we're so dramatic here. This is before I even got into this specialty, like as a nurse. Well, now this is why, like it truly is painful to these individuals.
Right. No. Yeah, I think.
So misdiagnosis is very high with this. And like you said, a lot of times it's interchangeable. They'll say lymphedema or lipedema. So, it's just super important to bring up these signs to anyone that you're seeing so they can make an appropriate diagnosis. And if not, send you on to somebody who, is more knowledgeable in that.
And then, when you're looking at the diagnosis of these, right, then people always want to know about the treatment or the management options that are out there, right? And so we need to stress that there's no definitive cure yet, right? But there are very effective management strategies, some more conservative than others, and some are first-line interventions, right? Usually, and I have patients that do a few of these. That compression therapy, right, is it for circulation and things like that. So you get that the compression stockings, the leggings, to reduce some of that pain and to support that lymphatic system to drain, right?
And then you have, you can do just like manual lymphatic drainage or massage, which there's people that are specialized in that specifically
for that, right? Correct. Yeah. There are physical therapists that work specifically and massage therapists specifically for that.
Yep.
And I know there are some of those like pumps, right? You can put those on your legs, and it gives the massage for you. And you know, there's a prescribed amount of time you wear it, and then switch and blah blah blah. So,
but you think like that's more specific to like lower extremities,
correct?
Right? You know, and
yes.
then you know you have individuals who definitely have, you know, a lot of skin. You know, you have this huge pannus, right? Which is like that, like, you know, front kind of belly that is
fupa, right?
Yeah,
I mean, that's what we called it at one point time.
Right. So
What's
there's
it
really
stand for?
Nice try, Mike. I'm not saying it here.
I'm not
Fat
saying
above
it here.
the beep, the pissoir. Yes, exactly. I'm sure you have to use that a lot when I talk, Mike. And, you know, other treatments, we want to have that low impact exercise. Aquatic therapy is good. And I have a lot
agree.
of, I actually have a patient recently. Have you ever heard of this? Deep water aerobics. And okay, now this is going to sound bad, and I apologize for our listeners. When this person was telling me about deep water aerobics, all I could think to myself was, that doesn't seem safe for a gal of her size who's having limited mobility issues. I'm like, oh, I don't know if I'd be like, yeah, girl,
Maybe
hop in the deep end and swim.
Maybe she had floaties on.
Maybe, you know what? Yes, you're making, that is a judgment. I'm sorry, I was being judgmental. And I just thought to myself, that seemed unsafe.
Yeah.
But you're right. You know, in water, myself included, right? We less stress on our joints, and probably, like you said, if it's painful with her legs and that, this might be very helpful for her.
And if patient had a high fat composition, they float. Yeah.
Like
fat.
It's like being in the Dead Sea.
It's like
only not the Dead Sea.
You're a little bit more
Beep,
buoyant.
see, beep, 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 there.
I know when I was heavier, I was more buoyant. Come on, you were too.
Excuse you.
Yeah.
Yes, true.
Yeah.
True.
So yeah, but I could see that. But it does seem like a great workout, right? If you're in deep water, like you're not.
I also was like, where can I go and do this deep water
Right.
aerobics? But I feel like I would drown because I feel like, oh, she probably's done it, so she's aggravated at it, and I would be in there. I'd be like, girl, I'm going down because I haven't done this yet, you know. But it helps, you know, and I think it helps, you know, the low impact exercise, things like that. It's going to help with mobility and maybe reduce some of that swelling, right?
Yeah, and you know, making sure that we have good skincare and bruise prevention. You know,
Nutrition and lifestyle changes.
yep. Want to make sure that we're protecting the skin from injury. You know, there could be a lot of rubbing and, you know, moist areas, right? So that puts you at risk for skin breakdown. So
Yeah.
making sure that's protected.
Yeah.
And
And
then
you-
surgical.
Yeah, there are surgical options. And again, talk to your provider. We're not saying go and do deep water aerobics or go and have a surgical procedure, right? Talk to your provider who can
Just the
send you on to
options.
specialists, right? Because you have that specialized liposuction, right? That helps remove some of that lipedema fat while preserving the lymphatic system. And then you can have that skin reduction therapy for some of that hanging tissue that we talked about can cause some of that irritation as well. And that some of that tissue that they may take off could be some of that tissue that has some of the lipedema issues.
No, for sure. And also something, if anyone is dealing with any of this, make sure you report any of these issues to your provider, because if you're having skin breakdown, rashes and such,
Those are sources of infection.
excuse me. Yeah,
Yeah.
for sure. But it's something that sometimes insurance would cover sometimes for the part of the removal of that skin.
Yeah, amen to the for me getting that skin removal surgery. But again, I had done many of these. Not that I had the lipedema, but I had done many of these treatments on my own. You know, the compression therapy, and you know, talk to my provider if there was skin breakdown under the folds of the pannus and things like that.
Yeah, because that's if that's documented, then real good chance that some of that procedure would be covered. But if it's not, and you've just been dealing with it on your own, and there's no proof, well, then you're kind of could be out of luck. So,
and treatment always depends on the stage. Stage that you talked about earlier, right? Stage 1, stage 2, stage 3, symptoms, mobility issues, right? And how quickly that it's recognized, right?
Yeah.
So then again, we go back to what you said. It's very important to discuss it with your PCP, so that way they can send you on to a clinician who knows more about lipedema, both vascular surgeon, or either plastics or specifically a lymphedema specialist, right? They'll fit you with those undergarments like we talked about. Other therapies that might be available, and there again, we talked about right mobility. And so if bicycling is causing chafing issues and issues like that, maybe it's not that. Maybe it is the water aerobics, or maybe it is simple walking or stretching, Pilates, yoga, whatever works, right? And then that documentation is a big thing for insurance coverage, like you said.
right.
But what's a big myth?
That it's not just. Are you asking me?
Yeah.
Oh, yeah. I mean, I would say that it's not what you're doing. Like,
Right.
I
It's
mean,
not
because
just a diet issue.
not just diet. It's not what you're intaking. It's not maybe your lack of exercise, because it truly is a medical condition.
Yeah, because could it be some genetics? Could it be
Absolutely.
Yeah.
But there are, there's some resources, not a lot of them, but, Lipedema Foundation, it's got patient support. You can do that. National Health Service page on lipedema. And then, there's, we have the Google, we have internet, make sure you're just looking from a reputable source, not just typing in on Google lymphedema sources,
Right.
Make sure there's medical basis behind it.
Yeah.
And again, talk to your provider, but it's a real thing, and get help if you need assistance.
No,
Right.
I agree. I agree. But on that note, Amy, where can our listeners find us?
On all the social medias, on all the podcasts, like us, follow us, share us, please. And, tell all your friends about us.
Yeah.
And write in, what do you want us to talk about? A lot of these topics we talk about are things that people have, asked us to discuss. So we want to hear all of your...
And maybe you listen to us while you're riding your stationary bike to get yourself a little bit of exercise or some
Absolutely.
stretching, or maybe that's the time you're wearing your compression garment, or put on your lipedema pump.
And they're
that way-
thinking of you.
And they're thinking of us, right? But again, some people will say they hear our voices already saying,
Yeah.
do this, do that, don't do this, don't do
Yeah.
that. So if any takeaway comes from this, I want my voice to tell you, talk to your primary care provider if you feel like there's an issue in anything. It doesn't have to just be obesity. Talk to your primary care provider.
Absolutely.
Don't just think I Googled it and that's what I should do.
Yep. No, for sure.
All right. Well, thank you for listening, and
Thank
we'll talk
you.
to you soon. And I'm Ben.
And I'm Amy.
And
Another
we're the
episode of The Heavy
Heavy
Truth.
Truth. Bye.
Bye.